name is Folo Marcus. I come from Yaoundé, the capital of the Republic of Cameroon. I've been sick for a very long time. I suffer from this thing called brain tumor. I've seen different doctors, even from other countries, and none of them could help me. It went on like that until one good day, my wife met a man from the road, a pastor. She called a pastor, and the pastor talked with her about her son who was in India. And he said he believed that this young man can help him. And he said, I will give you the phone number of the young man. And then he himself called. Fortunately, the boy answered, but in Yaoundé where we live. What a coincidence. And then they just called the boy came to my house. And then I asked him, you came from India? He said yes. And then he gave us the address of this my brother here. And he called immediately, answered.
Yes.
He said, can you, this is what we want you to do. We want you to look for a hospital that can handle so and so case. And that is how Leslie went to work. He has been a wonderful, wonderful young man. He has worked tirelessly. And ever since I heard about this place, I just fell in love with the place. I think the doctor can testify. When we finally arrived here, I look at the place, I just love the place. And when I met Dr. Naveen for the first time, it seemed as if we had known ourselves for so long. I fell in love again with him, and we were welcome, highly welcome. And from that time, we've lived here as a family. We enjoy the place. That is why when Dr. Naveen told us that we have to leave the world to some other place, it was a big problem to us. Because we were so used to the people. In fact, the nurses are wonderful. Everything here is wonderful. I mean, everything is wonderful. Everything is wonderful. So we really, really enjoy this hospital. We really, really enjoy the services rendered to us. All I can say is thank you very much.
Yeah.
Thank you.
Cameroon. I came here with my husband with the problem of brain tumor. So as he has said, when we arrived here, we started with the treatment, all the examinations and so on. He has said much of the things. But what I want to say here is the nursing care, the approach of the doctor. I was so blessed, the fact that doctor was not only treating my husband, was treating me psychologically. Each time he does anything to my husband, you come and explain to me, encourage me. I was so blessed. And he's such a man who is so open, he explains your situation. When you don't know anything, he tells you so much. It's so lovely. I love that. It's not flattering, it's from the truth. He's a good doctor. Even the patients in the hospital, the doctor, the staffs, the cleaners, they testify that Dr. Naren is a very good doctor. So we pray for him that God will give him long life to live and to help other people as he has helped us. And I want to say that even the workers in the Sunshine Hospital, they were so good. Even the cleaners were so good to us, the nurses, and so on and so forth. So as we are going to Cameroon, if we have any case, we'll just refer them that go to Sunshine Hospital, India, and saw a wonderful God-fearing doctor called Dr. Naveen. He's a blessing. He will help you. Thank you.
Thank you. Thank you. Okay. I am Dr. Naveen Mehrotra. I am the consultant neurosurgeon at the Sunshine Hospital. So I have a special training and interest in treating brain tumor patients. So we got a very good patient by name Mr. Marcus, who has the problem of headache for years, and you will be surprised to know that he himself made the diagnosis of brain tumor and went to the doctor and said that he has been having a headache and wanted a CT scan. So the first thing is, if you experience a headache which you feel is not like a routine headache, then you should always consult a doctor and get a scan. This means that probably you may be having a tumor. Headache everyone has, but if you feel the headache which is not normal, so you should always listen to the patient. And that was the time when his CT scan was done and we picked up the tumor was there. After picking up the tumor, he came to us late, but he had a lot of vision problems. He had a tumor which has been called, or which is called as a giant pituitary macroadenoma, meaning thereby that the tumor arises from the pituitary gland, which is the master gland of the human body. So we saw the scan and we approached, since it is a giant, meaning thereby it was more than 4 centimeters in any directions. So first we went ahead with an endoscope, meaning thereby we didn't give any incision on the head or the skull. We went through the nose and decompressed as much tumor as possible. Post decompression of the first surgery, or the first stage of the surgery, he had witnessed an improvement in the vision. But we cannot remove the tumor completely. Went to the nose, then we went into the skull, we opened the skull and tried to remove as much of the tumor as possible. Post removal of the tumor, he has been fine. These pituitary tumors are one of the most challenging tumors in the neurosurgery because they involve the base of the brain. Base of the brain means that they are the junction between the base of the brain and the nose of the eye. So we did a successful surgery and decompressed as much as possible without causing any deficit. Since he has come from Cameroon and has to go back, and there was the tumor capsule remaining, we offered radiation for him. And post radiation, the advantage of radiation is that probably the tumor may not grow, and since they are maybe coming late in the follow-up, so we may achieve a better tumor control. So the message is that if you have a headache which is not normal, you can consult a doctor, get a scan done, and if the scan reveals a tumor, a pituitary tumor, even though it may be giant or in the advanced stages, we can remove it maybe as much as possible, taking full care of the patient, and you may be surviving and doing as much as work as possible. Thank you.